So welcome everybody, and I wish I could tell you how many people are seeing this who are online, but I don't have that information just yet, but we did have over 500 registrants for the conference, so I would imagine we have quite a few folks who are watching this online. So this is the Homelessness and Digital Inclusion panel, and we have such a wealth of information in this panel. I am going to keep my words very few and make as much room as possible for each of them. So just before we get you to say a quick introduction of yourself, I would just want to remind people that there are feedback forms that you can access. There's a QR code for that. And we really encourage you to please complete any kind of feedback. We're really interested in seeing how we can improve. And also, for those of you here in person, you have to also scan a code for the door prize, because we have the names of the people who have signed in virtually, but we don't have yours. So if you want to be considered for that, please put your make sure that you register. All right, so the next 50 minutes, 50, not 15, 50, we'll be looking at the role that digital access has in supporting people who have experienced or are experiencing homelessness. This panel will talk about how digital inclusion intersects with the social determinants of health, and really tell you some stories from their backgrounds about how they have seen it impact the lives of people they work with. So if you would be so kind, there are 2 mics on the table, so maybe you could share the 2 of you at the end, and the 2 of you, and you, Cheryl, and I will share a microphone if you're okay with that. All right. Lisa, do you want to start and just give a quick introduction to who you are? It should be on. Yep.
Sure. I'm Lisa Ryan. I am the manager of supportive housing with the Department of Opportunities and Social Development. I've been there for about 3 years, and my prior history is working in the nonprofit sector as well as lived experience of homelessness.
Hello, everyone. My name is Sarah Eyland. I serve as the Supportive Housing for Individuals team lead with the YWCA, supporting women, two-spirited, and gender-diverse individuals in securing and maintaining housing. I am also somebody who lives with intersectionality. I'm an openly two-spirited, non-binary, multi-disabled person who's neurodivergent, a parent, an accessibility advocate, community volunteer, and I'm very nervous, as I'm sure you probably know. So thank you.
Oh, I can use. Oh, yeah.
And she has a great fashion sense, because look at this, seriously.
And the tattoos are top-notch. Hi, everybody. I'm Amanda Dodsworth, and I work for Peer Outreach Support Services and Education, also known as POSSE Project, and I do community-based education and also frontline outreach.
Hi, my name is Courtney Carmichael, and I'm the system planner at Social Open Doors Association. So we serve homelessness and housing insecurity in both Lunenburg and Queens County. And I'm also a GEO referral agent, so that kind of ties me into this talk.
My name is Cheryl Newcombe. I am actually the Chief Financial Officer of Atlantic Community Shelter Society. I come from Beacon House. That's how I started my work in homelessness, and drug it into my partnership at work, and we have continued to grow it above and beyond the capabilities that Beacon House had with its volunteer base. So that's how we got to where I am today. We have, I believe, at this point, 256 homeless beds, and they're not all busy, but it's a happening spot.
It sure is, and you're a bit of a legend. I just have to say, I heard a lot about you when I was working with the Department of Social Development and Opportunities. So It was really nice to be able to have you on this panel, and all of you on the panel. And while we've kept their introductions short, if you go to our website for today's session, you can read up more on each of them. So if you want to learn a little bit more, a much more fulsome bio on each of them. So we'll get started, and I think we'll start with this way this time. So you'll each have a bit of time to answer each question. We'll keep on top of the time, but we've limited it to 2 questions so that each one of you can have a chance to provide a bit of an answer for each one. So if you spend a little more time talking about one of the questions, you just pull back a little bit on the next one. We're pretty flexible around that. So the first question is, using a social determinant of health lens, please describe how you have seen digital inclusion improve the lives of people who are experiencing homelessness. Please highlight any areas where it has supported a wraparound approach and provide any types of examples or stories that can really bring it home. So Cheryl, if you're ready, we'll start with you.
Thank you very much. I don't know, the medical piece is a very specific piece of a very big thing. You can't imagine how large digital connection is for somebody that has been living in a tent with no money, with no food, with nowhere to go, who is probably wet and cold. And so to make it a medical thing is a giant leap from where we have to go, that it is a thing that changes lives completely. But to keep in context with the question, you know, a lot of our people have suffered medical decline because they have not had good food, they have not been warm, they have not been housed, they have been sick without any type of medical assistance. We find that arriving in the first time when we're first meeting our people and taking them to an emergency room the first time, it's not always a welcoming spot for them because they may not be as clean as they would be if they had opportunity. They may not be trusting because they've had some very bad experiences, and it's not always the friendliest place for these people. So turning it from a time when they, you know, had absolutely no access to anything to a position where somebody has handed them a phone, that's the lifeline. There is now, all of a sudden, we can dial 911 if we needed to dial 911. Can you imagine? We can use it to get maple and actually see a doctor that is not going to say you smell funny and not going to say you have to wait for 11 hours in a lineup to get to emerge when they really don't have the social coping skills that they need right now to wait 11 hours in a crowded room. There are a lot of things, and that's just the medical piece. Like, that is if they're not have been stabbed, or, you know, because they have been living a life that is not safe. And so to make it a medical thing, and what the medical changes, I have seen people who, I have an example of, it would have been ball field time at POSSE, when we took someone to Cobequid with an extremely bad toothache, an abscessed tooth, a mess. They need to go on antibiotics before they can do anything about the tooth. So we have all been there. You go home for 7 days and take your antibiotics and come on back, and we'll see what happens. Well, in the meantime, we had sepsis set in. So somebody came and got me at Beacon House. I was on Metropolitan Avenue, and said, he's not doing very good. Maybe he's allergic to his antibiotic. So, okay, well, let's go see. So we pick him up and we take him back to Cobequid, and we find out he is not allergic to his antibiotic. His antibiotic was late, and he was septic, and he needed to be rushed downtown to the hospital. He needed to be put on life-saving antibiotic drips, and he was not in good other medical condition. He wasn't well fed. So he had all kinds of things that were just fighting against him, and not knowing whether he was going to make it out. So before we went home that night, I gave him a phone, and it had minutes, but it was the only one I had in the car at the time. And I gave him my phone number, and I said, I need to know. If you need me to come back, I need to know. So about 4 o'clock in the morning, I got a call, and he'd been there since about 7 o'clock in the afternoon, and he had been there, I would say, since probably 10 o'clock in the morning till we got to downtown. And then he'd been there, and nobody had fed him or offered him a drink of water. And he wouldn't ask. So somebody would come in and change his bag, his IV. And I said, well, ask somebody for something to eat. Oh, I can't do that. I said, give him your phone for a minute and let me, right? So I said, I'll be in, it's going to take me half an hour to get there. So down we go. And by the time we got there, this person that I had spoken to was apologizing profusely that he'd been there as long as he had been without anything. But without that, nothing. So, and many of our clients are like this. They won't ask for anything. They come into care thinking they don't deserve anything. So they won't ask for anything. They're used to being told that, they're not worthy. And so to just try and make it a medical question is just so far from the reality of what changes when you give somebody a phone, whether they're ready to use it or not, or it just gives them the ability to give it to somebody else and have somebody else speak for them. So I just wanted people to know it's not just their ability, because giving them a phone doesn't mean they're going to be able to speak for themselves. However, it does change the whole world they live in. I guess that's hers. Thank you.
Thank you so much, Cheryl. All right, Courtney, you want to tell us your thoughts?
I feel like digital inclusion is so important for the unhoused community. I have seen it help countless people, and I really feel like digital inclusion has to come before housing, because in order to set up your housing, you need to be able to connect with people, whether that's hooking up your power, even connecting with other organizations like my own that may help you to establish yourself where you're going. As an example, we have provided a cell phone with a plan to someone that is experiencing homelessness, and having that connection for employment when you work in a job where they call you infrequently, and if you miss that call, then you miss that opportunity for that income that could have changed your situation. That's like a small example, and the medical piece is obviously one of them, the employment and education, and I really think that digital inclusion or exclusion touches every part of social determinants of someone's health.
Yeah, very good. Thank you so much. Appreciate that. Amanda?
I think I would echo all of this. I think sometimes when we have always had access to connection, because it's not just a phone, it's not just data, it's connection to your medical resources, to your support systems, to your family, to your kids, to whatever. Sometimes we take for granted how isolating it is if we don't have it. But if you have broken your phone and you need to wait 3 days to get it fixed, you know how alone you feel and how separated from everybody else you feel. And so yeah, the medical and educational and access to services, but also the social, like that social connection as a determinant of health is also like such a necessary part of everyone's wellness. But especially if you are unhoused and maybe you're in a rural area, you might not be in an encampment with 30 other people. You may not have people to talk to on a regular basis. It might be a 2.5-hour walk to get into town from where you are. We supported an individual in a more rural area who, during the floods that happened in the West Hants area in 2023, was quite literally, his location was swept away. A flash flood came in and swept him and his tent away, and he managed to have a phone in his pocket, grabbed a tree, climbed the tree, and was able to call for help. But without that connectivity, no one would have known where he was. And we, while we had safety planning with that person, that safety planning was like, if you don't see me in a week, come looking for me. And so thank gosh that he had a phone. Thank gosh he had the ability to be able to call for help and was airlifted out of a tree. He still tells that story. It's a little traumatic, but he's like, I was in a helicopter. But like without that device, what might have happened to him? And who would have known to go looking for him? I think sometimes when, for folks who've never had to like lose their phones or never had to go periods of time without the ability to connect, they don't realize the weight of that and how that can impact our mental wellness and our physical wellness. The other component of that is that for people who are experiencing homelessness, how do you know what time it is? You know, because you maybe have your phone, right? Like, how do you know when your appointment is? If your doctor is calling you because your blood work's come back and they need to see you again, they need to be able to connect with you. You can't book an appointment. You can't, because you can't get follow-up. So if you're leaving a message for income assistance and you don't have a phone and you're leaving it on the message of an organization's number, what if they can't reach you? And so all of those things that people require just for their day-to-day survival are intrinsically interlinked with being digitally connected.
Yeah. Those are powerful examples. Thank you very much for sharing that. Sarah?
So I would like to connect with that in terms of housing being a human right. And the YWCA is a housing first organization. And when we're supporting people, women, gender diverse, two-spirited people, understanding that the social determinants of health, one of those is a safe place to be. It's a place, a home for yourself to be able to close the door and know that you're safe. And if you're not safe, then, how are you able to function in a world that is already kind of scary, So I'd also like to speak to the fact that with a lot of participants and a lot of people within the YWCA that are supported by the YWCA also are people who live with intersectionality every day. So it could be somebody who has been recently released from incarceration who was experiencing homelessness because they had no one else to connect to in their community, and then turned into a situation where they then become disabled as a result of an assault on the street. It could be a multitude of things. It could be somebody who is Indigenous and has been displaced from their family and is unable to cope and might have children, and the cost of living is already really high. So when you have children and you need multiple rooms to be able to have the children in, that speaks to a lot of the how if you are part of equity-seeking groups already, and you have multiple barriers on top of all of the barriers that you're already navigating, that becomes really exhausting. So, you know, like, I think that it's just important to understand and recognize that housing and homelessness could be anybody's experience. It's not limited to one specific person, but when somebody's experiencing a multitude of barriers on top of what like a regular, quote unquote, regular person would be, it's just exponentially more difficult.
Thank you, Sarah. Lisa?
Yeah, I don't really know what else I can add to what's been said. As they were talking, I was thinking a lot about how the solution to homelessness is actually quite simple. It's housing. It's always going to be housing. That's always the solution. But getting to housing and maintaining your housing requires a lot more work, and it can be a lot more complex. And all of that hinges on being able to connect. Homelessness is already very isolating, as we've heard. It can, just the experience of it makes you feel like an outsider to everything. And being able to connect to the services and the people who make you feel like more than your experience is so important to propel the drive towards housing. Because every single barrier and closed door is a knock at the hope. It knocks down the hope. And if hope isn't there, progress doesn't happen. And so digital inclusion can be more than just connecting with, you know, doctors and with systems and resources. It can also be reconnecting with family and finding your inclusion in your very local community. It can be FaceTiming with your housing support worker when you're feeling really excluded and alone and frankly hopeless, because the reality that people are experiencing right now and the reality of our society is that hope is very much dwindling. And so every opportunity that we can give that, especially when it creates inclusion, whether it's social inclusion, it will always be linked to digital inclusion.
Thank you for that. I think that's it. The combination of your responses is such a perfect, kind of covers all of the areas that we're talking about being able to secure housing. How do you apply for housing? Mm-hmm. If you're trying to rent a space today, pretty much everyone is applying online to be able to rent a space. If you are trying to even access, where would I find a place to rent? How would you do that if you don't have access? And if you have health issues, as Cheryl was talking specifically about the medical aspect of the social determinants of health, that, you know, how many areas of that are impacted by being able to actually, as you said, maple or call a doctor or attend an AA meeting online, or attend an NA meeting online, or be able to talk to your family when you're feeling so low you can't get beyond what you're feeling in the moment, but you can talk to family about it. All of those pieces are all part and parcel of this. So thank you for sharing those stories. It's really helpful to hear it from the variety of perspectives. So when we think of the future, and how could we improve in Nova Scotia? What are some of the things we could do to build better bridges for people who are experiencing homelessness or who are very connected to your programs? They might be living in a shelter village. They might be in a shelter. They might be connected to the Y or to any of your organizations. What are the next level up? What are the ways that Nova Scotia can further improve how we are providing digital inclusion to people who are experiencing homelessness or at risk of homelessness? Is the other, like, precarious housing is just as important around this issue, because we all know where it leads if you don't have the tools you need to take the next step. So what are the ways that you see that we could do better, or if you've heard of ways that people use it that you feel we could expand on, or if there are other resources that could be provided? Any of your ideas would be welcome. Why don't we start with you, Lisa, this time?
Sure. So I'll just really, I guess, go back to my own personal experience. When I first moved to Nova Scotia, it was right at the beginning of the pandemic. And I, at the time, was working as a consultant, so doing much of my work at home. We didn't really know much about rural Nova Scotia. We were moving to the South Shore, and due to the housing crisis, we were very limited in where we could actually land because there was no housing. And we also had a child, which I don't know if any of you know. If you have a child, that's a barrier to housing. Just your cat, fine. Child, no. And so we were able to land a spot pretty rapidly. And after we signed the lease and moved in, we realized that there was no cellular access and there was no internet access to where we lived. And so we ended up using satellite internet, which negatively impacted my work because I was also, locked in a home with, at the time, a 4-year-old who needed supervision, and we were in a pandemic. So a lot of my work relied on me being able to be connected. And I couldn't be connected because, again, I was living in a pretty populated area that had no cell reception unless I stood at the end of my driveway, or didn't have actual connectivity for internet. And my joke was I would get internet as long as there was no wind, no cloud, no tree moving, that was fine. And so at that time, I began to think a lot about the number of families who, through the pandemic, were not just disconnected from just normal everyday life, but because of where we lived, we were disconnected from everywhere, and how that negatively impacted a lot of families who are experiencing significant rates of poverty and food insecurity, and how I think one of the things in Nova Scotia that we really do need to start focusing on is addressing all of the areas that do not have reception, because there is a significant number of areas in rural communities that do not have access to internet or cellular reception. Many of those individuals are living in very vulnerable situations. There are high rates of intimate partner violence in those areas, and there is no route for those individuals to be able to reach out for help because they can't even get cellular reception. And so I think as we look to the future, a fully connected Nova Scotia will help lift people out of very significant dangerous situations. But not only that, it will give more employment opportunities to folks who are really isolated and not able to afford things like cars and gas on top of all the bills that they have right now.
Thanks so much, Lisa. I think one of the things that really stands out for me in your story are the last thing you just mentioned, which was if you don't have cars, and you mentioned your child, your daughter. And so what has come up a lot in the stories we hear is that providing digital access has addressed the issues of transportation and childcare for a lot of people. It's really kind of opened up their lives to a completely different level of opportunity because they can access so much without leaving their house. They don't have to have a car. They don't have to try to find a babysitter. They don't have to. So that was a really good example of that, actually. Thank you for sharing. That's a great story. Thank you. Sarah.
So I'm somebody who uses two-eyed seeing to kind of dictate my life and help me observe the world. And, when it comes to digital inclusion and how things are supported, like some of the exciting things, I can use the term that used in a lot of disabled spaces of nothing about us without us. Yes. And to be able to even sit on a panel like this, I feel very fortunate to be able to do that. And I think that really speaks to kind of the excitement of the fact that things are progressing, much like having this entire event today. I also think that, just the idea that more people are becoming more aware of the difficulties that are happening in this world, and people are in I say professional spaces in terms of like supporting participants are really beginning and continuing to engage and connect and with supporting with policies and framework that's in place to be able to help support that. So that's what I got.
Policy change, I hear. Your story also reminded me of, we also have heard some really potent stories when we're able to provide assistive technology. And that has really changed lives.
Yes, I can speak as
Yes.
somebody because
Yes.
I am deaf.
Yeah.
I'm also someone with 2, sometimes 3 phones at a time. And,
Right.
My hearing aids use Bluetooth, and sometimes it just goes with whatever strength of Bluetooth is at the same time. So I could be having a very important conversation, and all of a sudden it turns to like heavy metal from the car down the street. To speak to that, like having the availability of accessible technology and having, grants and more funding, because let's be honest, like everything is all about money, and we need money to do the things. So yes, absolutely, accessibility. I'm excited for more of that.
Yes, I thought you might be. Thank you for sharing that.
I don't know if this is
Amanda.
on. Okay. I think one thing that we can do better is to unpack the stigma of people who are experiencing homelessness owning phones. We see it on a constant basis, like the greater public going, and they don't have a house, but they have an iPhone. Without the understanding that the vast majority of the phones that they're using are refurbished phones, or they're old phones, it's grandma's, next door neighbor's granddaughter's phone, or they've gotten them from Geo, or a different organization has done a drive to collect phones, and that they, like I can get a phone plan for $38 a month, but I can't pay rent for $38 a month. And so even if I'm living in a tent, having a phone, like that should not be an issue, and there shouldn't be a stigma or a shame or an upset from the general public about people who are unhoused but have phones. I always think that's a really strange thing, and I think that like all organizations and just like the public and private sector can work harder at like unpacking the stigma around that for people. I see it on Facebook all the time. Like people are like angry that other people have a phone. It's so strange to me. But like, so like working against the stigma of like being connected while unhoused is actually just really important. We have a wait list of individuals. There are so many people in the communities. We operate in 4 communities. So in the communities that we're working in, we have wait lists. Specifically, we prioritize the 2 rural communities that we're in because there are more resources in our urban communities. But we have wait lists, and then for staff to have to, Savannah specifically very often is the one, hi Savannah, who has to like try to do equity-based, so like a needs-based assessment, but you know that between the 7 people on the wait list, and there's only 2 phones to give out, 7 of them need them. And yet you have to like pick, and then it can build sometimes animosity between, because maybe they're living in the same encampment and you got a phone but I didn't get a phone, and why are they special and why are you favoriting them, and without an understanding of all of that goes in. And so I say this like understanding that of course money is finite and that we don't have billions of phones in the back room, but like there's so many more people that need to be connected, and it's hard for workers. So I think a thing we could do is to support the people who are making those decisions, and just encourage them that they're doing needs-based assessments and doing their best. And it's not their fault that not everybody has a phone. It's just, it can be really emotionally draining to make those decisions of picking and choosing who gets access to services, right? So
We definitely have many staff at Geo who feel that deeply, and as you say, it does come down to funding to be able to provide more devices, more connection to be able to continue this work. So, and I don't want to lose sight of the stigma piece as well, because I do think that really is a critical point. Any geo staff here, write that down. Because I hear that too all the time, and certainly when I was working in the homelessness area, that we would hear those types of things all the time, and it is so counterintuitive to everything that makes me breathe. I can't really wrap my head around it, but it is, when you think about it, as if a person is able to have access to all of these different kinds of resources when they are living as at the lowest income rate in the province, if you can give them one tool, and we can't afford all of them, but if we can just provide more of them, if we could give that tool that could help them then be able to address all those other areas, how, you know, the importance of that, so that stigma piece is really something that it's important to the work, and it's important as well in terms of us kind of all working together to make sure we're doing what we can and partnering on that to make sure that destigmatizing is something we intentionally work on together and all share that messaging. Yeah, thank you for that. Courtney.
I second that response so much. I think I've already said it to someone today. Maintaining equity, like that's all at the front of our minds when you're frontline workers. You want to be equitable. You want to give equal opportunity to everyone. Employment opportunities for phones, because it's life-changing. It feels amazing to give someone a phone that is changing their life, a laptop that is giving their kids access to school and education, and the stress that alleviates off a human being it's wonderful to be able to do that. But it is so hard to choose. Yeah. And I'm not saying it as a criticism of anyone, any service providers, anyone. I don't know what the right answer is, and I don't know if anyone does. I think it's just something we should think about moving forward. How do we make it more equitable? And I don't have the answer or have a suggestion. But something we also have come across that is hard is there's a lot of loss or theft when in the unhoused community because devices are very valuable, and this is just a reality that is going to happen, and that's very hard when someone has been so happy and then it's gone, and it may only be days later. And do you give them another? Like, you just don't know what to do. So I think I do second that answer so much. And that's my addition to it, that just something we could think of going forward for all of us.
Definitely. So appreciate that. Thank you so much for that. I'm going to pass it over to you, Cheryl.
Thank you. I just want to add to that. I have given somebody a phone that was beaten that night, and his phone was taken. And it was just because somebody else in the encampment thought they wanted it more and deserved it more. And so it's so difficult to walk down this. But on the other side of this, with Matt's little announcement today about what's going to happen in the collection, I don't know, I saw somebody nod when I said Beacon House the first time, that there's some knowledge in the group about what Beacon House is and does. And Beacon House is a consortium of 17 churches. So when we opened the shelter on Metropolitan Avenue, the first week, I went to 4 of the churches and gave a little speech about what we were doing. And then the next week we did 3, and somebody else helped. We got 28 phones in 2 weeks from going and standing at the front of the church and saying, you know what, we need your old phones. And people were calling and driving over. And until we started talking about that today, I'd forgotten about that. And it's time we all did that. Everybody can ask, you got an extra phone? Because we really need it. And that'll help with the stigma too. As if they understand that they're helping, they're not going to say anything about the homeless guy that's got a phone next time. So I think it's a lot upon us who do have them to start asking the questions and letting other people know that this is ours to solve. We can't, we do need more funding, we do need more internet, we do need all that, but the government can't fix everything, and we can. So, you know, the charitable thing is ask all your neighbors, give us your phones, make sure Matt gets his 1,000 phones at Christmas so we can give them to everybody.
Well, Cheryl, I certainly can't thank you enough for giving me an opportunity to talk about the phone drive we're going to do. So it is actually a really great thought, because we had a lot of thinking here about what we could do in the future, and that phone drive was something we also had to process. Like it's gonna cost Geo money to do the phone drives, but then how many phones could we get? And so you know, you balance it out, and it's so worthwhile. And I myself have probably 4 cell phones in a drawer in my house because my son dropped off his old ones recently. So for this reason. And I bet every household, everyone who lives in a house has a drawer that does have a cell phone that you've used in the past, or a charger, right? Yes, thank you for that. And it is a way that maybe we will have the opportunity to provide more of the phones to more people, and not eliminate, but at least reduce those really difficult decisions. We are partnering with a new partner, which I don't think we've announced yet, so I'm not gonna steal anybody's thunder, but who's offered to do the phone repairs for the phones that we collect for free. So it's an amazing, amazing opportunity, and December will be the month we're doing it in. And so this is, thank you, Cheryl, for bringing it up. And I really didn't mean to, be the disruptor to the group. But how could I not, honestly? So I guess the one thing, we have a little bit of time. We have about 15 minutes left, and one of the things that I find has always brought the most meaning to the work that we do, and a lot of the time you're doing, I don't know, a PowerPoint, or you're doing, something that feels really tedious, and you're like, why am I doing this again? But the thing that always brings it home are the stories. And so I'm wondering if there is one story that you can think of that stands out in your mind, of someone that you work with. And I can think of some people from actually the shelter villages that we've heard stories from, that about how it's changed their lives. But if there's someone at your work, through your friend groups, where you've seen how it's changed their life in particular. I'm wondering if any of you have an example that you could share. Yes, please.
So we have an individual who did get a Geo phone, and that was very exciting for them and everything. But then they kind of left one community and went to another community, and they are actively doing a bunch of their own research about, and then messaging us and saying, "Hey, I was looking at this, shelter option. Do you think that this is something that would I could qualify for? And can you help me?" So they are actively doing self-advocacy and being able to find resources in a way that they weren't able to do before, for themselves. So fostering a sense of independence, fostering a sense of their own personal power, and then also being able to ask the people that they trust questions. Do you think this would be a good fit for me? Do you know how I apply to that? Hey, do you know who I'd call? Because I'd like to call them myself to ask them. So it's just really nice to see people. It's confidence building, it's skills building, and it's really nice to see people be able to do their own self-advocacy. Love it.
It really is, and that sense of self-worth that comes from just being able to do something for yourself instead of just asking someone to do it for you. That's an amazing story. Thank you so much. Is anybody else? Cheryl?
We have a individual that was, he's actually on Metropolitan Avenue, and he was given a phone, and we have a little relationship going with the green garbage trucks. I know the VP of HR there, and if we call and say we have somebody and somebody needs to pick them up at 7 o'clock in the morning or at 6 o'clock in the morning, we call and they'll get a job. It's not charity. They have to work hard. They have to be there every day at the side of the road, but they will be picked up and they will get their job. So he had a phone, and he had to have a phone for him to get the call back to say, be there in the morning. And in the next 7 days, he took 4 more guys by sharing the phone with them to let them get their call from the garbage truck, so that there were 4 of them waiting on the side of the road in the morning. And that's him sharing his phone. So it not only empowered him, but it empowered him to help. And that helps. That happens a lot too.
That's an amazing story. Yeah. And it's also a very Nova Scotia story, isn't it? There's something about this province where people are like, well, I know someone who knows someone, so I'm going to give them a call and say, I have some folks who could use some work. And they're going to go, yeah, okay, I'll call them. And I love that. Thank you for sharing that. Yes?
So I can speak that I've seen a participant go from not having access to any technology to getting a phone and internet through Geo, and go on to then have access to supports to be able to support employment, which resulted in them being able to transition out of programs into independent housing. I've seen moms, new moms, young moms, who don't have access to money to be able to afford phones, have the ability to get a tablet to be able to support, seeing their family and seeing their child that may have been in care. I've seen participants who have had barriers in even getting really serious medical health concerns, and having access to appointments and results and that sort of thing, to erase some of the barriers that already come with having those types of diagnoses. So all really powerful things, very powerful to witness, and all because digitally they have access to it, there's inclusion, and there's action behind it. There's the action of getting it behind it.
Wow. Thank you so much for sharing that. We might just see if there's anyone in the audience who has any questions. I don't know if anybody has had something come up where either you've thought of your own story, or if you would like to ask a question. Thoughts, questions, queries? Do you want to lay the accolades on these people? Feel free. They're out there doing the work. Please.
Yeah, I was just going to, it was something I experienced, I work with Geo, and I often, check Facebook Marketplace or whatever just to see what's popping up. Are people selling them? I don't see much evidence of that. And then I ran into a young man who was homeless, and he was living in one of the pallet shelters. And he asked me, he was like, well, what do you do? And I said, oh, I work for this not-for-profit Geo. And he was ran as fast as he could to go get his Chromebook and show it to me. And I was like, oh my God, that's great. And he was not in good shape. And I was like, I'm glad to see you still have it. And he was like, what, are you kidding me? I would never sell this. He was like, this is how I can contact my mom. This is how I can do everything. And I was just like, how important that was to him. And yeah, the fact that this was the one resource that he felt he needed to hold on to, it was very impactful at the time, and very reassuring as well too, that this is really making a difference in other people's lives. So.
Thank you so much for sharing that story. I think.
Can I share something?
Pardon?
Can
Yes.
I share something?
Oh, yes. Sorry. We'll do Lisa and then Terry Lynn.
It goes along with what what you had mentioned. So it's, I worked in another province. Obviously, I moved here in during the pandemic. But one of the, we had housed this individual who had faced a lot of racial discrimination because they were Indigenous, and they were around 70 years old. And so we were able to acquire a provincial public housing unit for this individual, and they were very nervous about moving in because of the level of discrimination that they had faced. And so we had a spare just a smartphone. We didn't have any funds for a plan, but they could connect to Wi-Fi. And one day I was in my office and I got a message from them, and it was a recording of the rental provider being very, very racist, to the point that it was just absolutely disgusting. And so I had called the provincial department and lodged a complaint, and they didn't believe me. They didn't believe that this person was having that situation. So I was like, okay, here's some evidence. I have a video.
All right.
And I was able to provide that. And we were able to get that rental provider removed from public housing because of the behaviors. They had received multiple complaints from their tenants who were either Indigenous or African ancestry, and they had not done anything because nobody provided proof, and most people didn't have the ability to record it because they didn't have access to a cell phone. And so this gentleman did have that because we were able to find a phone. He was able to text that to me, and then we were able to have it addressed and have him move to a new unit, which I'm very proud to say nearly 10 years later, he's still housed there.
Wow, wow. Thank you. Go Terry Lynn, and then I'm going to go to Eilish because I know she wants me to do something. I'm just not sure what.
Just kind of a quick story. As a supplier, we don't generally have a lot of experience with the frontline issues. We hear a lot of stories, obviously, from the people that we work with through GEO and supporting the initiatives and whatnot. But Danielle, you were actually involved in this in the beginning of D3 when we were negotiating the mobile plans and getting these little Wi-Fi hotspots going. I think Geo got a call for a gentleman or a family that was housing insecure, and he was a couple weeks. He did have a place, but he was a few weeks in between. He was looking for a job. He had a phone, but it was only a few minutes, a 2 gig connection. And did he have 3 kids in the back of his car who were school-age children? And Danielle called and said, how quickly can we get one of these devices? And I said, well, probably today. I would imagine we could do it today. And we did, and it's sad to think how easy it was for us to do that, you know what I mean? So that's just kind of a story that I shared, that was my first kind of first-hand experience, I guess. We're really feeling what that person could be going through. And as a mother, oh my God, or your parents or whatever, not necessarily a mother, having to think about those kids in the backseat and their education and the stress and all that. So I think it's great that we're all here and talking about it.
Thank you so much for sharing that. Eilish, I know you want to talk about QR codes.
Well, I was just thinking that a reminder, I was coming to remind Bonnie, I was trying to be subtle about it. She called me out in front of all of you. If you do scan, yeah, we're going to use that. If you do scan this, if you are the lucky winner of the $250 gift card to Orchard, if you felt so inclined, you do have the option that you could donate it back.
Oh.
And so that could potentially be $250 towards someone else having a device that could be life-changing,
Nice.
like we heard about here today.
Thank you so much, Eilish.
all.
I appreciate it. All right, folks, that's it for us for today. I want to give the deepest gratitude to this amazing panel for sharing your stories, for sharing your knowledge, your experience, and I can tell the heart you put into the work. So I have a great appreciation for that as well. So let's give them a round of applause. And thank you.